So welcome everybody to our Spotlight on the Allied Health Professions webinar today. So before we begin, I just want to go over some housekeeping. So the session today is being recorded and will be available on demand on the HMY Careers Hub website in the coming weeks. To help with the smooth running of the session, what we've done is we've tried to disable everybody's microphones and cameras. If it hasn't happened for you, could I please ask that you disable or turn your camera off and your microphones off? If you have any questions during the webinar, then please pop those into the chat box and our professional colleagues will answer any of those either as we go through the session or at the end of the session. That's great, thank you. So I just want to say welcome again. So my name is Tina Jenkinson and I work for the Humber and North Yorkshire Health and Care Partnership as the Careers and Employability Manager. So for those of you that don't know, the Humber and North Yorkshire Health and Care Partnership formed in 2022 and it comprises of NHS organisations, local councils, health and care providers, voluntary, community and social enterprise organisations as well. So the partnership is one of 42 integrated care systems which cover England to meet the health and care needs across an area, coordinate services and plan in a way that improves population health and reduces inequalities between different groups. So we work across a geographical area of more than 1,500 square miles, and serve a population of 1.7 million people, all with varying health and care needs. So the area that we cover is Humber and North Yorkshire. So that includes Hull, East Riding, York, North Yorkshire, North Lincolnshire and North East Lincolnshire. So in order for us to meet the health and care needs of our population, we need to ensure that we have an appropriately skilled workforce reflective of the communities we serve. So this is where my role comes in as Careers Employability Manager in developing that talent pipeline and inspiring and growing our future workforce. So one of the ways in which we do this is by delivering these webinars to showcase the range of careers available in the sector and highlight the variety of different routes that there are into the sector. So I'm delighted to be bringing this webinar to you today to shine a spotlight on our careers in our allied health professions and the variety of routes into the allied health professions. So these professions are a vital part of our workforce that treat, rehabilitate and improve the lives of our patients. In Humber and North Yorkshire, we need to train and recruit more allied health professions to meet the demand of our patients. So in today's session, we're going to have an introduction to the allied health professions. So that'll be an overview of all the 15 allied health professions and then hear from some of our professionals working in the sector about their career journey and the pathway that they've taken into the role they're in now. So what I'll do now is hand over to my colleague Keely Summers, who's going to give you an overview of the allied health professions and then talk about her role as a diagnostic radiographer. So over to you, Keely.
So hello everybody, like Tina said, my name's Keely Summers, so I'm Humber and North Yorkshire's AHP lead of the faculty and I am a diagnostic radiographer, so I will go on to explain what diagnostic radiographer. So allied health profession is an umbrella term for 15 professions. Next slide please. So allied health professions are made up of them 15 different healthcare professions and we are the third largest workforce in the NHS. We provide a system-wide care to assess, treat, diagnose and discharge patients across all the organisations. So AHPs are involved in managing patients' care of all ages to start well, live well and age well. So we are all governed by one, which is osteopaths, by something called a Health and Care Professionals Council. And they basically make sure that we are doing the right thing and we've got the right qualifications to be able to do our professions. We work in primary care, which is GPs, secondary care, which is your hospitals, voluntary organisations, private organisations, and also in schools and prisons. Next slide, please. So I'm just going to quickly go through the 15 professions, but also on these link is an Aspiring Allies website, which you can Google Aspiring Allies, and it takes you into case studies there and takes you into a little bit more information about all the allied health professionals. But just so you have a bit of an overview, which are included in the 15, I've listed them here, and that's art therapists, drama therapists, dietitians, occupational therapists, music therapists, podiatrists, operating department practitioners and orthoptists. Next slide, please. Osteopaths, paramedics, speech and language therapists, diagnostic radiographers, prosthetists and orthotists, and physiotherapists and therapeutic radiographers. Next slide, please. So each of the AHP professions requires a degree level qualification approved by what we just talked about, the HCPC. This has traditionally been through the route of university. However, there's different opportunities now to get into some of these professions, and that can be through a degree apprenticeship or to do a 2-year MSc when you've already got a science degree. So you do a top up in the profession you want to go into. So the entry qualification to do a traditional degree and apprenticeship would be include GCSEs and 3 A levels or a level 3 qualification, often involving a science subject, or if you're going to do the MSc top up, you need your BSc degree. There are also opportunities to be able to do these level 3 qualifications, level 2 and level 3 qualifications in the NHS if you come in at a support worker level. And some of the organisations will support you through apprenticeships, working your way up and be able to go on to do your degree apprenticeship. For a registered AHP working in the NHS, the pay grade will start off at a Gender for Change Band 5. You can Google the Band 5s and you can show the levels that you can get up to: level Band 5, Band 6, Band 7 and usually Band 8, and to a higher management it can get up to Band 9. It is similar to nursing. So next slide, please. So if you go through the university, we just put in a little bit of what you can actually get through financial support. So for some of the professions which are listed here, you can actually apply for what's called an NHS Learning Support Fund, and that gives you a £5,000 each year top up. So it's open to everybody. It doesn't matter what it isn't what means tested. That's the word. It isn't means tested, so that could be £15,000 for the duration of your whole course. You can also have tuition fee loans and maintenance loans. Next slide, please. So along with AHP roles, we have support worker roles that we've just mentioned a little bit before, and most of the 15 professions do have support worker roles, and the level of responsibility will coincide with the pay that you get, depending on your qualifications and your experience. So a minimum qualification of getting in is your GCSEs, but if you do come in without any qualifications, you can do the level 2 apprenticeship while you're in the organisations, and then they will support you up. So once in your role, you could actually go on to do the degree apprenticeship, should that be something you wish. Some people just like being the support worker and stay, and that banding is usually to 2 and 4, and sometimes even higher. They are developing leadership roles in support worker roles, which some go up to Band 5 and Band 6. Next slide, please. So apprenticeships at the moment are very much internal. It is increasing to external applicants, and I do think this will progress in the future, but at the moment it is usually open. They usually grow their own, so you start with your support workers and you go work your way up through that. The degree apprenticeships for the AHPs are still a very new route, so due to this small number of AHP professions do not currently have routes, such as music, drama and art, orthoptics and osteopaths, but organisations are beginning to realise this, and in the future these probably will open up. Next slide, please. So your career progression being an AHP profession. So clinically, you can advance into advanced practitioner roles and consultant roles, but there's also, you can expand out and go into digital transformation, managerial roles, leadership roles, fellowships, education, public health, research and entrepreneurship. So some people, if they're in physiotherapy, podiatrists, they open their own businesses and work privately along with the NHS. So next slide, please. And that's it for AHPs. I think we're taking questions at the end. Is that right, Tina? So I'll go straight on to my diagnostic.
Yeah, super. That's great. Thanks, Keely.
So next slide, please. So as I've previously said, I am a diagnostic radiographer. Next slide, please. And And when I was at school, I never always wanted to be a radiographer. I actually aspired to be a vet, and that was where I wanted to be, and that's where I thought I was going to end up. But life doesn't always go like that. So for the age of 10 to 16, I was going to be an equine vet, a horse vet. So, but when I turned to age 16, it wasn't the year that I had planned. Things went wrong. My mum and dad wanted to move me from one county to another county. I didn't want that. I only passed 2 GCSEs. We had family bereavements. It wasn't a good place. The veterinary, I thought, I'm never going to be a vet now. So we moved to another county, and I had to take my GCSEs again. And I'm pleased to say I passed them all. But probably not with the right grade to be a vet. So I went on to do my A-levels, still not knowing what I wanted to be. Passed my A-levels, and then I took a year out because I didn't want to go to university. I had no idea what I wanted to be, and then I had a horse at the time, and it had got an ailment, and it went off to this hospital, and it ended up having a load of x-rays, and I was like, oh, how did you do that? How have you got into that? And they had to do a radiography degree, and then they went on to be an equine radiographer. I thought, that's it, that's what I wanted to do. So I applied for university thinking I was going to be an equine radiographer. Got into Leeds University to do a radiography degree. Loved it so much, stayed on doing an NHS, stayed in the NHS and kept horses as my hobby. So that all went out the window, and I have no regrets. I love my job. So I qualified in 1999 in Leeds and started working in Leeds and worked my way up until 2009, where I ended up doing a postgraduate certificate and became an advanced radiographer practitioner. So that means that I didn't take the x-rays, I actually reported on them and said what was wrong with them and their next pathway and where they wanted to go. And then in 2018, I left Leeds and started working in Scunthorpe and Goole as head of Scunthorpe and Goole X-ray department. And then in 2020, I became head of the Scunthorpe and Goole department. And then 2022, I took this job, which is lead of the Humber and North Yorkshire AHP faculty. And then recently, I've just enrolled on a leadership apprenticeship, which is a level 7 masters to do senior leadership. So it just shows you you're never too old to keep on learning. So next slide, please. So a day in a diagnostic radiographer. So diagnostic radiographers mainly work in the X-ray department. So they see a range of patients from A&E majors to minors to resource, GP patients, dental patients, orthopaedic and fracture clinic patients. They work on wards and inpatients, so quite a range of patients. And then in that bottom right-hand corner, that is mobile x-rays. So we go out when patients are too poorly to come to department, we go out onto the wards, we work in intensive care and baby care unit. And then we also go to theatre as well. So that top right-hand corner, that's in theatre. So that's when we go to do orthopaedic theatre. So if you've broke any bones and they want wires putting in or nails putting in, we x-ray them while they put them nails in. But we also do urology, which is kidneys. So if they want tubes putting in the kidneys or any spinal work done. And then we do, in the main department, we also called what's fluoroscopy. Fluoroscopy is when it's live and it's actually like a video. So we also do tubes in hearts, tubes in kidneys, tubes going down into your stomach, and we x-ray while that happens. But yeah, if you do go into plain film radiography, which is all your x-raying, you can also go off into MRI, CT, nuclear medicine, do advanced practice like I've described what I did, or you can go into ultrasound. Next slide. I think that's me done.
I think that's it. Yeah, thanks very much, Keely. I think that was really interesting to see that pathway that you've taken, actually what it is that a radiographer does on a day-to-day basis. So I'd really like to hand over now to Anna Key. Now, Anna is also a radiographer, but Anna is a therapeutic radiographer, and she's going to talk through her career pathway to becoming a therapeutic radiographer. Anna, over to you.
Thank you, Tina. So I'm Anna Key. I'm a senior therapeutic radiographer. My school years, particularly secondary, were very challenging. I struggled to remain focused because I had no idea what I wanted to do as a career. It made it quite difficult for me to push myself and to apply myself to my work. Despite the odds, I left school with a good amount of GCSEs, enough to see me into college education, which was my preferred choice at the time. With an open mind to careers, I just started a course that I thought I would enjoy, which was health and social care. I was told this would open lots of doors to jobs and other courses in the future. I have a sister with cerebral palsy and I'm from a family of lots of teachers, so I assumed I would head down a route of some kind of childcare, special needs or primary teaching eventually. But as the course progressed, I realised that I was interested in areas of adult health and social care, more so than working with children, and I liked the idea of working in a hospital setting. I started to consider going to university, but I was concerned that I didn't have enough A-levels to get accepted onto a course. With dietetics loosely in mind, I spoke to the career support at college, who suggested an access to science degree at Teesside University, which was local to me, to start in September 2005. I applied and I was accepted. I was really looking forward to going to university, but I still didn't have a clear goal or career idea in mind at all. Towards the end of my second year of college, however, things took a very bad turn. I became quite unwell and was incredibly fatigued. And after months of not feeling myself, I was diagnosed with cancer in one of my salivary glands in my neck. I managed just to complete the final assessments and exams before having surgery and head and neck radiotherapy, which finished in September 2005. This was absolutely terrible timing for starting university. As I just finished radiotherapy, I was due to start university the next day. So I was exhausted, I was really depressed, struggling to come to terms with what had happened that year. And by the end of the first semester, with the support of my family, I actually withdrew from the degree to take some time out to recover. So for the months following, while I was recovering, I took on some part-time jobs. I did bar work, hairdressing, retail, you name it, I gave it a go. But I had no end goal in sight. I was really lost and confused about what to do. I was just about surviving and getting through at that point. Healthcare was completely off the cards. I thought that wasn't going to be it for me at all in the end. But just when I thought that was that, in the summer of 2006, my mum was reading the local newspaper and spotted an advert for therapeutic radiographers to train at my local hospital. She said, "Radiotherapy, isn't that the treatment you had, Anna?" And that was that. I'd known I wanted to work in a hospital. I didn't know much about allied health professionals at the time. I just was really interested in those professionals that had supported me and looked after me during my treatment, and I wanted to find out more. I also wanted to make something positive come out of that horrible experience that I'd had just the year before. The university told me that I have to go to Sheffield, the hospital told me I'd have to go to Sheffield Hallam University in order to do the theory elements of my training. I was absolutely geared up for that, no problem. I was ready and raring to go at that point. Now, that summer, the university, Sheffield Hallam, had lowered their entry requirements. So I was able to get onto the course. You could say that I got lucky, but I believe it was totally meant to be, and that was what I was meant to be doing with my life. I had to work really hard at the academic work in university because, as I mentioned, I didn't have a lot of the foundations of sciences that a lot of my peers had. But I absolutely sailed through clinical. I loved it, always high achieving, doing well in clinical portfolio work and demonstrating interpersonal skills that are really relevant to healthcare professions. I passed with a 2-1 and secured a job in Hull. Working at Hull University teaching hospitals has been an amazing experience for me. I was able to quickly progress into a senior position. I've been given multiple role development opportunities and have been closely involved in the introduction and development of new technologies and equipment. I've completed master's level study and I'm supported by my managers to attend training, events and take on roles such as my current position, which is a secondment at the Humber and North Yorkshire AHP faculty. My wider radiotherapy team are caring individuals and we maintain a common goal, which is to support our patients through their difficult times. Now, whilst I would never recommend entering an AHP career quite the way that I did, I do feel it's important for me today to share how adversity and barriers in life can lead us onto and give us our focus and drive and lead us onto things that we never thought were possible. I also believe that we can do anything if we set our mind to it. Next slide, please, Tina. So radiotherapy is used for the treatment of cancers and some benign conditions with high energy X-rays. We use CT scanners to localise and plan patients' treatments, and we use machines called linear accelerators to deliver that treatment. Both require the radiographers to have highly technical skills. Every morning, radiographers are responsible for switching on the machines and running quality assurance checks to ensure that the machines are safe to use. In Hull, we have 6 machines in the department with 5 running to full capacity and treating approximately 30 patients a day. Most patients will have a planned number of sessions from anything from 1 to 37 treatments, Monday to Friday. Patients start arriving at 8 a.m. and have about, on average, a 15-minute appointment. The radiographers greet the patients and show them into the treatment room. The fact that radiographers get to meet patients most days of their treatment really helps us to build rapport with them and put them at ease. This is important because we need patients to feel comfortable to disclose concerns or issues relating to physical or mental well-being. This could be anything from treatment-induced side effects to just chatting about how they are coping generally. Following these chats, radiographers like myself have a responsibility to support and refer patients to other professionals within the multidisciplinary team, such as dedicated radiotherapy nurses, dietitians, and psychological services. Next, we set the patient up on the treatment couch in a comfortable and reproducible position using specific equipment that helps to ensure treatment accuracy. The patient will undress in the area that is being treated so that permanent skin marks can be aligned to green lasers which locate the central point of the treatment area. We use calculations and lots of maths to determine the exact location of the treatment, and the linear accelerators, either Halcyon or TrueBeam that you can see in the pictures, are capable of taking CT images in order to check the treatment position. Online soft tissue imaging using CT has made it possible for us to improve treatment accuracy by considering the daily differences in organ size, position, and motion. For example, we can now deliver high-dose ablative radiotherapy to small early-stage lung tumours with 4-dimensional soft tissue imaging that actually shows tumour motion. The machine then knows at which point within a patient's normal breathing cycle the tumour will be. There are lots of opportunities as a therapeutic radiographer to learn about new advancing technologies and develop specialised skills. You can never say that radiotherapy is boring because it's far too busy for that. Being a therapeutic radiographer is incredibly rewarding because of the invaluable support that we give to our patients and their carers. Thank you.
That's great. Thanks very much for sharing your story with us, Anna. Next, we'd like to hear from our speech and language therapy apprentice, and that is Catherine Stafford. So over to you, Catherine.
Hiya. Yeah, my name's Catherine. I'm currently the assistant practitioner on the rehabilitation ward in Goole, and a couple of months ago got accepted to do my speech and language therapy apprenticeship, but it doesn't start till next September, so I'm still in limbo at the moment. Yeah, we can go on to the next slide. I was quite similar to what's been said before. I had no idea what I wanted to do when I was at school. I enjoyed doing health and social care GCSE. It was a double award that was offered at our school with the local college at the time to do an afternoon a week. And I sort of again was told, and the vibe was that there's lots of opportunities in health and social care. There's all sorts of different paths that people don't even know exist. So I carried on and went to the local college and did a BTEC diploma for my A-levels equivalent. And that was 2 years that involved a lot of placements and hands-on learning and working, which made me realise that I learned much better at that. And I was able to gain a lot more experience in different things. These range from nurseries to working with adults to working with disabilities. Again, no really clear path, never any real career end goal. But then going through finishing college, I worked with various different disabilities and learning difficulties and really enjoyed the fact when a client or patient really needed your help and what you was doing was helping their day-to-day life. I saw that there was a position first in mental health with the NHS and thought, okay, NHS might be some areas for progression and things. It give me a bit more direction of what I'd like to do or something a bit more specific. I worked on a mental health ward at first for 2 years, which I enjoyed, but I knew it wasn't for me. I saw that there was then in another trust and actually realised there was other trusts and the NHS was a much broader, bigger scope than what I thought it was to start with. And I saw a rehabilitation support worker post on a brain injury ward in Goole, where I am now. So I started as a band 2 support worker, which is very similar to like a care support role, working with nursing team and therapists. Then I was lucky enough to be offered a band 3 position on the therapy team as one of the therapy assistants. Again, wasn't really sure what that involved, didn't know much about brain injury at the time, and certainly didn't know much about the differences between therapy teams and the nursing teams. It naturally progressed that there was, my role was a new role, so there wasn't anybody to cover or shadow or to see what the job was like before. But the other therapy assistants on the ward had already naturally sort of, one had been pushed further to occupational therapy and one had been more interested in physiotherapy. So that left me to do the speech and language therapy because there wasn't one. At the time, the speech and language therapist was only allocated a few days a week on the ward, so I naturally jumped into the role of being her assistant. This was really good, and in that, again, I was offered, it was a band 3 to 4 progression route, which again, I didn't really understand. But then at the time, they was pushing out foundation degrees, so I'd have a day out a week for 2 years, going again to the local university that was supported at the college in Scunthorpe, and I was able to do my foundation degree, which got me a band 4 position and the assistant practitioner post rather than the therapy assistant. I thought, brilliant, absolutely great. I have peaked. Never thought I'd get a band 3, let alone a band 4. Was really pleased with the progress and really pleased with the course. It was not easier, but I dealt with it much better than I thought I would. I'm not very keen on academic and the student thing. Like I said, never really wanted to go to university. It was never really a clear thing for me to want to do it enough. I like the aspect of the foundation degree because you're working alongside your job role, very much like an apprenticeship. You're doing a lot of hands-on and learning, then taking that back to the day a week and putting that into your assignments and things for a broader picture. There was a lot of talk of apprenticeships going to be starting, and I thought, yeah, it didn't really seem to come to anything at the time. And the top-up course for speech and language therapy just wasn't an option at the time like it was for occupational therapy and physiotherapy. But then lucky enough, at the beginning of the year, it got put out, the trust got some funding, and there was an apprenticeship position for 5 different areas, speech and language therapy being one of them. So I interviewed and thought, it's maybe a bit out of my reach. I'd be quite happy to stay in the job that I am, but also I'm really keen to progress and happy with how I managed the foundation degree to think, actually, I can do this. I could have gone and done more at the time, and I needed to give myself a bit more credit, and that there is other ways to learn, not just going to university, full-time courses, a lot of academic. So yeah, June, July, I found out that I'd been offered the apprenticeship for speech and language therapy in the trust, and it's to start in September. Which seems ages away, but I know it's going to go quick. And again, I'm really pleased because I never thought it was an option for me to progress to be a qualified member of staff in that way, band 5 and 6 positions options. Because again, I've always thought I'm not really very keen on the academic side, the full-time sort of thing like that. But with the apprenticeship, it's going to be 60% work-based learning. So I'm going to be based on my ward, but classed as a student. They will cover my position that I'm in now. So I can just focus on being that apprentice and the student. And then it's all online delivery and placements, which again is ideal for me. I've got a little boy who's fast approaching 3. There's absolutely no chance now that I would be able to warrant or facilitate being a full-time student and going to do my speech and language therapy degree otherwise, if it involved travelling back and forth to a university, the workload that it would involve, the cost that it would involve, the travel and the placements, etc., and then actually doing the work that's required in your own time. So for me, an apprenticeship position is absolutely perfect. I never thought it would sort of happen, and now I'm just really keen and excited to get started and see how it goes, and really pleased that it is actually an option. And I wished when I was at school and college, they were options or they were known about more, that you can work your way through and you can be supported to get the qualifications. It doesn't have to be a direct university full-time route. Next. Day to day, I think with speech and language therapy, it's quite a broad one because it does depend what sort of area you're in and what sort of age group and things like that you're with. I'm lucky enough to be on a rehabilitation ward in Goole. Like I say, we have patients who've suffered and acquired a brain injury. This could be through stroke or traffic accident, all sorts of things. So day to day, it can sort of vary with patients. I can work with some younger patients from anywhere from 18 up to 80 plus, depending on what's happened. If they've got funding and come to our ward, they don't usually come to us until they're sort of medically stable. So they will be at a first hospital setting following the incident that they've had. And then, they get funding to come to us for 12-week blocks at a time of rehab. We could have these patients for 12 weeks or up to 2 years if they're improving and showing things. They obviously work with all the different therapists, but my role is the speech and language therapist currently will assess our patients, whether they've got communication difficulties or swallowing difficulties, and then my job involves doing one-to-one therapy sessions with them. That could be with low-tech whiteboards, that could be with cards, that could be with 3D objects, that could be apps on iPads and things. And we complete daily sort of therapy tasks for them. Also in my role, I run like a communication group, again, for the patients who are specific and need communication therapies, which again learns a lot about social skills and communication with groups. I can assess with meal observations. The speech and language therapist herself can only do the assessment and change any diet recommendations, whether people are having to have textured diets because of the swallowing problems at the time. But then I can do one-to-one sessions and help do oral trials and things like that, and hand over when I think that they're ready for a reassessment for the speech therapist. My role also involves providing training like confidence sessions for family members. It's quite daunting when we don't think about our swallow being an issue. When family members are coming in and they're taking them on home visits and things like that and family events, it can be quite daunting when someone's having to have a different textured diet, whether that's puree or through the stages that we have, having to have thickened fluids and things. So we do a lot of sessions that we invite family members in and have therapy sessions together, mixing fluids, adapting foods to the correct textures and things like that. A lot of hands-on so that they can really get a feel for it. Another part of mine could be assisting making communication aids, like communication books, low tech, that's just like, say, paper cards with their own items and things like that. Family members, for when we're at the early stage, if they needed a communication aid, but it's not advanced enough yet to be looking at technologies such as iPads and speech devices. Again, another one is a bit of assistance with mouth care and helping staff and family members again with the importance of mouth care. If anybody's on textured diets and any sort of swallowing difficulties, a massive risk to us is chest infections and things like that. So we have days with staff and patients and their relatives and things going through mouth care and having lots of functional tasks doing that. Another one that's really important, because we're a rehab ward, like say our patients are with us so long, it's trying to adapt sessions for social activities and real life functional tasks, such as going to the local coffee shops and things and working on their speech and ordering drinks, using their phones, thinking about appointments and things that they're going to have to do when they go back home, if things do or don't get better. That could be, like I say, making doctor's appointment. We can be practicing using the phone, writing scripts, having a lot of scenario, a lot of hands-on working. This week we've been to the local cafe because a lot of them were sort of desperate for a fried breakfast. So the agreement was that they had to work on ordering skills, talking again in the community, talking with people that they don't know, because when they're on the ward, it's obviously very easy to get comfortable. The staff know each other's routines, so they don't actually have to maximise the communication as much as what they would when they go home. Again, sort of social calendar things, looking at Christmas, Pancake Day, things like that. Patients that we have, if they have got swallowing difficulties and having to have a textured diet, we look at how we can adapt that and how we can make things for them so they can feel a bit more involved and have a bit more orientation. But like I say, you could go into many areas with paediatrics, clinics, in the community, on acute hospital wards and things like that. But my role, let's say, is rehabilitation ward, and it's more long term. So it's really good because we get really good rapport, and I feel like we've got that time and sort of luxury to make sessions really personalised and look at people's goals, whether that's being able to order their wife a bunch of flowers for their anniversary, and looking at all the different things and different ways we can do that. So I really enjoy it because of that and that personal element, because we have patients for long periods of time rather than a small appointment and maybe not seeing them again for a few months. But yeah, lots of different areas for speech language therapy and different ways to get into it. Thank you.
That's great. Thanks very much, Catherine. That was really interesting. And I think it's really interesting to see those apprenticeship pathways and how you don't necessarily have to go down the academic university route. You can actually start off in employment and then progress within the sector. So thanks for sharing your story with us. Next, I'm going to hand over to my colleague, Molly Lister. Now, Molly is a student dietitian and she's going to talk through her pathway. Over to you, Molly.
Hello everybody, my name is Molly and I'm a student dietitian at Leeds Beckett University. I'm doing a master's degree at the moment. So just before I start this, I thought I'd give a little bit of a definition of what a dietitian is, because I didn't know if people had a good understanding of what it is that a dietitian does. So dietitians are a qualified and regulated health professional that assess, diagnose and treat dietary and nutritional problems to improve a person's health, treat a disease or condition by giving education and practical personalised advice to patients, carers, clients and colleagues. So to start off with, like everybody else, from the ages of 11 to 16, I really wasn't sure what I wanted to do, but I was really interested in sports and I played a lot of sports throughout school. At the age of 16, I passed all my GCSEs. I went to a private school, so I felt like there was a lot of pressure for me to achieve and to do well and progress academically. And I was given the opportunity to volunteer at Pinderfields Hospital, helping with meal times and experiencing what a hospital environment was like. And this was a first for me, and I really enjoyed it. And I spent time helping patients pick their meal choices for the coming week, offering them cups of tea from the tea trolley, and just spent time chatting with them, which I thought was interesting to hear people's stories. And at the age of 18, I passed my A-levels. I did chemistry, biology and PE, so it's quite science-based, very science-heavy, and I got a place to study at university. So in 2019, excuse me, sorry, I started my first degree in sports and exercise nutrition because I really enjoyed sports. And this degree was really interesting because it was the first time that I'd looked at nutrition in relation to sports, and this is the time when it really solidified my interest in nutrition. And then the coronavirus pandemic started, and this was really challenging for me because there wasn't really much shadowing experience or any availability to get experience in a career in sports nutrition. I was connecting with people on LinkedIn and asking for the opportunities, but many of them were saying that they didn't even know if their job was stable, which was quite worrying at the time. So I was looking at other interests, and I started to explore the route of clinical nutrition, and I managed to get a job as a dietetic assistant, which is a support worker to the dietitians, and I started this in 2021 at the same time when I was doing my first degree. So I worked alongside doing the second and the third year of my degree, which was really challenging, but I managed to get through it. There was a lot of pressure in that job because we were coming out of towards the end of the pandemic, so there was a lot of backlog and there was a lot of patients that hadn't been seen, and there was a lot going on. So then after that, I completed my first degree, and I secured a place on the master's course I'm doing now. I started that in 2022, and I ended up leaving my job as a dietetic assistant because I couldn't balance studying full time alongside working, which is really sad for me because I really enjoyed being in that environment and having the patient contact and supporting everybody. So currently I'm on my B placement, which is my second placement. My first placement was in January, where I was at Pinderfields and Dewsbury. On this placement, I'm in Harrogate for 13 weeks, and then after this placement, I've got one next year that starts in March, and that one's 12 weeks, which is my last one. So I'm due to qualify in August next year, and then I'm not sure where I want to go from there because there's lots of areas that I have which are of interest to me. So you can go into diabetes, oncology. There's all areas that you can go into, and there are also careers within the hospital, within community, within freelance, research, catering and health centres, to name a few. Please may I have the next slide? Thank you. So as I said, I'm a student dietitian, so I'm not yet qualified, but dietitians will see both adults and children in a range of settings, including on the wards, in clinic, in group sessions, and in their own home, which is the community teams, with a wide variety of health conditions. They also support patients that are being artificially fed, so that could be through an NG tube, which is a tube that goes through your nose and into your stomach, through a PEG tube, which it goes directly into the stomach, through TPN, which goes through a vein in your heart. There's so that's artificial feeding, and they also provide tailored advice based on a person's individual needs. So as I mentioned before, I'm on my B placement, so I'm spending time with the adult oncology teams, the diabetes team and the community teams. So within the oncology team, we support patients who are going through active cancer treatments. The diabetes team, we support patients whose bodies don't respond to insulin in the same way. And the community teams, we visit patients within their own homes who are unable to come into the hospital for a clinic appointment. Appointments range from 30 minutes to an hour, depending on if the patient's new or is already known to us. After discussing diet histories and existing patient knowledge of their condition, I would provide evidence-based knowledge around the individual dietary and nutritional problems that they have, and then provide guidance alongside the patient to ensure that the goals that we set together are specific, measurable, achievable, relevant and timely. We also work really closely with speech and language therapy as they will provide suggestions on a level diet, and then it's making sure that we're working with the patient to ensure that they're getting enough of the food within that level. I hope that when I do qualify, I will develop as a specialist, and I really hope to work my way up and hopefully find what I'm interested in. So yeah.
That's fabulous. Thanks very much, Molly. That was really interesting. Thank you for sharing your story with us. I'm now going to hand over to Lucy, and Lucy is our occupational therapy apprentice. So over to you, Lucy.
Thank you. Hi everyone, so my name's Lucy and I am a first year occupational therapy student. I study at Sheffield Hallam and I work in Hull at the Royal Infirmary. So just a quick introduction to occupational therapy. It's about letting people do the things they need to do, want to do and like to do. So occupations are things such as washing and dressing, eating, sleeping, being able to catch a bus and go to work or go to education and like sports and social activities and stuff like that. And it's about overcoming barriers to completing these occupations and things like that. So next slide, please. So in year 10, I decided I wanted to be a physiotherapist. But unfortunately, I didn't get the grades I needed at A level to do physio. So I studied at Hull for sports rehabilitation, which is similar to physio. It's very like musculoskeletal based. And once I completed that degree, I managed to get a job as a therapy assistant at Hull University teaching hospitals. On trauma orthopedics, where we mainly deal with like broken bones and hip surgeries and stuff like that. So in that role, I was offered the opportunity to progress to a Band 5 exercise practitioner. So this is like a trial job. So I worked as a occupational therapist and a physiotherapist at a Band 5 level. And this is where I really developed my interest in occupational therapy. However, because it was just a trial job, at the end of the year, I got debanded back to a Band 3 therapy assistant. However, I was approached by management about the apprenticeship. So it was a bit of a whirlwind. So in January, we sort of discussed it and agreed they'd put me forward for it. I applied in January, got the interview in February, and then I started in March. So it was all quite a quick turnaround. And at the minute, I'm just about to finish my first year. So it's works out about a week every month. I will do some work with the university. So 2 days will be in Sheffield and 3 days will be online. And then obviously we'll get an assignment and we have to do that alongside working. But we do get 2 mentors to support us. So one is my manager at work, and then another's someone from the university. And they're just there to offer support throughout the 3 years of the apprenticeship, and just support us as we go, really. And then we also get 6 hours every week as off-the-job learning. So it's essentially 6 hours we can use for whatever we want to do. So I tend to use it for assignments, shadowing other services, so like stroke, community, and places like that, and new training. And then if we go to the next slide, please. So as occupational therapists, we work across the lifespan. So we can work with paediatrics from birth up until elderly end of life. So the OT process is that we'll get a referral and then we'd start information gathering. So we essentially want to learn about the patient. We want to know what's important to them and what they're struggling with. And we can get this information from the patients themselves, medical notes, families, carers, residential homes and places like that. So once we've got all that information, we can identify what the problems are, what the barriers there are, and then we can set some goals. So then these goals will then determine which sort of interventions and treatments that we're going to implement with the patients. So they can be things like mobility assessments, equipment assessments and provisions, functional assessments like washing, dressing and kitchen assessments. And then if we go to the next slide, please. So I don't know if you can see that very well, but we also work across a range of settings, including mental health, physical health, acute hospital trusts, communities, education, workplace settings as well. So occupations are essential to living. They give our lives meaning and structure. So by participating in occupations, we're enhancing our health and well-being. So health and well-being is multifactorial, and it can include mental health, physical health and cognition. So no matter what a person is referred for, as an occupational therapist, we're going to treat the person as a whole and we're going to treat them holistically. So this means that even if they're admitted with a physical issue, we're still going to consider their mental health and cognition in our assessments and treatments. So our focus here is to identify what's important to the individual and develop goals and interventions to overcome these. So we can do this by teaching compensatory techniques, providing rehabilitation and providing equipment. So a day as an OT can vary massively, as every individual is so different and they all have different meaningful goals and occupations. So no day is ever the same. But here on the slide, you can see a picture of some of the interventions which we might implement with our patients. So we've got things like pottery making, dog walking, money management, sports, leisure, baking, and then we've got kitchen assessments, wheelchair assessments, bath chairs, toilet seat and frame combined, and standing equipment. And then we've got things like cognitive assessments, which is like a standardised form, which will give us insight into how patients are functioning. And then we also touch briefly on hand and upper limb therapy. So we can do things like resting hand splints, thumb spikers, like standardised assessments and stuff. But the main underpinning theory is that every individual is unique and we've got to tailor our approach to what's meaningful to them and support them in achieving their goals and occupational performance. I believe that's it. Thank you.
That's lovely. Thanks very much, Lucy. I really appreciate you going through that with us and sharing your pathway. We're finally going to move on to my next colleague, Donna, who is a podiatrist, and Donna is going to share her pathway and what a podiatrist is and does with us. So over to you, Donna.
Hi everybody, I'm Donna Welch. I'm currently the Operations Manager for Podiatry for City Healthcare Partnership. If you want to move on to the next slide, please, Tina. So I'm hoping you're all wanting to step into the podiatry profession, and certainly if you like picking, podding, squeezing, this is the job for you. Next slide, please. So podiatry is one of the smaller allied health professions. We represent just 3% of the AHP workforce, but we specialise in the lower limb. When you ask anybody about podiatry, they think that we just focus on feet, but actually our learning is from the hip down. So the idea is that we provide preventative advice, care, assessment, diagnosis, and treat a whole range of problems which affect the whole of the lower limb. And we play a huge part in reducing the risk of amputation, infection, deformity and hospital admissions. And believe me, you can't smile if your feet are hurting you. So one of the benefits of being a podiatrist is everybody wants to see you. Keeping people mobile and retaining their independence affects the quality of their life. And so this is a really, really rewarding job. Keely's also alluded to it at the beginning. There is opportunities in podiatry to have your own practice. So they work across both the NHS and independent practice. And you can work across a range of environments, including wound care, diabetes, sports, forensic, and of course, podiatric surgery. Next slide, please. So if we've got time, I have put in a video which is available on YouTube by the College of Podiatry. So as you can see, you can find lots of information out about podiatry on the Royal College of Podiatry's website. So just to give you a brief introduction to my career pathway. So I finished my A-levels way back in 1991, which makes me extremely old. And I feel extremely old on this call today. But I started employment as a podiatry assistant. I always wanted to be a podiatrist, but after I'd done my A-levels, I just wanted to earn some money. So I started as a Band 3 podiatry assistant. And then in 2003, after I'd had my children, I decided I wanted to do the degree. So I joined the first cohort on the part-time pathway at Huddersfield University. It's quite a challenging time. I had 2 young children, still worked as a podiatry assistant for 16 hours a week and went to university on the remaining time. But that just opened up so many doors for me. I graduated in 2007 and then started my registered career as a podiatrist as a Band 5 at Scunthorpe, before quickly being successful in achieving a Band 6 over at Humber NHS Foundation Trust. And then I was promoted in 2010 to be an advanced podiatrist, and I specialised in the diabetic foot. Was successful in being promoted further in 2018 to the principal podiatrist and then the ops manager. And I have just recently, this year, had a secondment with Health Education England as the National Education and Training Lead. So in that time, I've progressed from a Band 3 to an 8B, which is massive. So the opportunities are huge for you, even if you leave school with no qualifications. Next slide, please. So why is the foot so interesting? A few facts here. The foot is made up of 33 joints. There's actually 26 bones in each foot, and there's countless nerves and blood vessels which link your feet to your heart, brain and spine. But 3 out of 4 people will experience serious foot problems in their lifetime. So there's lots of interesting facts about feet. Next slide, please. So why podiatry? So the employability is amazing. You are almost guaranteed a job in the NHS. For everybody who graduates, there's at least 1.5 jobs vacant for you. It's huge satisfaction. Originally, when I was at school, I did think for a brief moment about being a dentist, but who wants to see a dentist? They hurt you. Whereas everybody wants to see a podiatrist. You make people feel better. There's huge flexibility. Like I say, you can work for yourself. You can go into different career opportunities, and there is an opportunity to specialise in things such as surgery, rheumatology or diabetes. There is now the opportunity, as everybody's discussed, to study through an apprenticeship. So you have the ability to earn whilst learning. Next slide, please. So there's apprenticeships for podiatry right from level 3, academic level 3, which is your support worker, right up to being a podiatric surgeon apprentice. So your options are endless, and you can continue to earn whilst you're progressing your career. Next slide, please. So that's it from me. Hope to see you all soon.
Oh, thanks very much, Donna. That was a quick overview of podiatry, but I think you've sold it well. So thanks very much to all of our speakers today. We've just got a little bit of time left, I think, just for any Q&As, if any have come in from those on the call today. I'm just going to see if I can access the chat quickly and see if we've got any questions for people.
There's no questions been put in the chat other than people want the slides to be shared, Tina.
Shared, yeah.
I've been monitoring it.
Oh, thanks so much, Donna. Yeah, so what we will do is we will make sure that the slides are uploaded to the Careers Hub website. We've also recorded the session today. So once the recording's been edited, that will be uploaded onto our Careers Hub website as well, and I'll also make sure it's shared in the next schools and college newsletter that goes out. So that'll be the December issue. We'll share a link to the webinar too. So I just want to say a huge thank you to all of our guest speakers for their time today and sharing their experiences with us. I did mention we have our Careers Hub website. So obviously, if you want any more information about any of the careers in health and care, then please do log on to our website. There is an interactive career pathway on there where you can search for different job opportunities and careers within the health and care sector. There's information on there around jobs, apprenticeships, and education and training opportunities. So if you get time to have a look at that, please do. I hope that you've all found the session useful in learning about the allied health professions and the various routes that you can take to get into the sector. What I would like to do and ask for people to do before you leave the call today is to complete a little evaluation, and if it works, I'm going to pop that in the chat, and it's just 6 questions for you to quickly answer, just to get some feedback about today's session, what you liked, what you didn't like. This is the first webinar that we've done with the spotlight on, so it will help us improve and tailor our future webinars. So I am hopefully going to stop sharing my screen in a moment and see if I can run the poll. I'm hoping it's thinking about it. There we go. So the questions are there in the chat now. So if before you leave the call, if you wouldn't mind just completing that quickly, that would be really helpful.